We have apologies from Councillor Dan, Councillor MacDonald will be substituting, and apologies from Councillor Deacon. Also, Councillor Loveridge will be a little bit late.
Yeah.
And also Councillor Mahoney will be about an hour late. But he should be full of the Christmas spirit because he's gone to this school carol service, so that's good. Okay. Any declarations of interest? No. Right. We have the minutes from the last meeting. Are you happy to agree them?
Yeah, I think.
I know you've all slept since then, but hopefully you're still reminded. So you're happy that I signed them?
Yeah,
Great stuff.
Supplement pack, there's also the minutes of the select committee.
And likewise, there's also the minutes of the Select Committee report that we did a couple of weeks ago. So are you happy with those minutes? We'll talk about the what's come out of them and the recommendations when we get to that on the agenda. But so those minutes. Yeah. Chair's urgent business. Just to say that I understand that the CQC watched our webcast of our meeting that we had on primary care services, and let's say they were well pleased with the depth to which our scrutiny went. So thank you all to the panel that sat on that. Obviously we'll talk about that later again, as I say, with what we're going to do, but that won't be a one-off. I think we have to understand that that's going to have to carry on as a select committee.
Yeah.
Okay, which brings us to the Sustainability and Transformation Partnership. Rob, welcome to you. At least it's positively balmy down here in the southwest. I've just come back from a few days in Birmingham and Coventry and have lovely snow pictures, which went well with the Christmas market that I went to. So it's got Bristol, temperature rose, it was brilliant. Okay, the floor is yours.
Thank you. I can concur with that because I spent the weekend in Wales at my father's house and we had 1.5 feet of snow with minus 12 degrees temperatures, so it's really balmy down here. Thank you, Chair. So I'm not sure, did you want me to get the information up on the screen in relation to the report, or are you happy for me to just refer to it? I don't have a presentation. I was going to go through it.
I think basically we take the report as they've read it and you can talk through it on major issues.
Thank you, Chair. So there are 7 updates that I wanted to cover off in terms of the report, and I'll try and relate them where possible to the Plymouth system as well, just in terms of scrutiny being aware of where this information goes. So the CCG governing bodies will receive this information informally, and we also have the update that goes to our Programme Delivery Executive Group, the group that we call PDEG, which is driving the STP. So in terms of the key messages and the bits I wanted to draw out particularly are item 1 relates to the new clinical leader for the Devon STP. And this is quite an important role. It's a role that was previously occupied by Dr. Phil Hughes from Plymouth Hospitals Trust. And the real thrust of that role has been to lead what's been called the STP Clinical Cabinet. And it's the Clinical Cabinet which has really been ratifying and looking at the clinical consequences of some of the STP decisions and the STP strategy. So it's made up of lots of clinicians from secondary care in the hospital, from primary care GPs, therapists, social worker, and nursing colleagues are also part of that forum. And Phil will now be stepping down from his role in leading that piece of work. And Dr. Rob Dyer is going to be taking that forward. So he is the medical director from South Devon and Torbay Foundation Trust, and he will be taking forward the role that Phil has undertaken. It's a normal cyclical opportunity. It is helpful for the Plymouth system because obviously it means that Dr. Hughes is able to return full-time to the Plymouth system in terms of helping support some of the challenges that we face. So Dr. Dyer will now be taking forward the time commitment required for that. The other key messages in the document around the top 10 messages around successes and developments. and these are key items that we've taken forward to all organisations. So in terms of those key messages, in terms of overall performance, the STP as a whole, so North, East, West and South, we still continue to have top 25% national performance around urgent care, so that includes the 4-hour A&E standard, but also mental health care and also in preventing what we call 52-week breaches for patients who wait too long for their surgical procedures. We're also noted for our continued good working together across the organisations. That's all of the trusts and the commissioners and the local authorities. We are considered to be an exemplar in terms of some of our development around our collaboration, and probably the most prominent feature for that has been our mutual support agreement, whereby if we have workforce pressures within one part of Devon and there is opportunity to support from another part, we enact it. And this system has actually been one of the first areas to enact the mutual support agreement, whereby clinicians from the Royal Devon and Exeter have been supporting Plymouth Hospitals Trust around their breast symptomatic pathway to make sure that the service is maintained. So lots of other areas have been trying to think about how they would do this, but we don't know of any other areas that have actually achieved delivering that kind of collaboration. So we've been very much noted for that. We are making progress in relation to our delayed transfers of care and how we're reducing them. And you'll note in the report it describes a reduction in August, but we know from our recent position that we've continued to drive that reduction. And actually for Plymouth, we really are now making good progress on this. So the CQC that have just been in to visit us have noted that our position is much improved, and that we are much closer to the target and much more in line with our trajectory. The target is 3.5% standard. So it's good to note that progress, and South Devon is also doing particularly well in the top 20. We continue to drive our best bed is your own bed approach, and particularly in North, East and South Devon, this has actually meant that because of their shifting care towards out-of-hospital care, those hospitals are coping much, much better with their pressures, and they've actually been able to close over 200 beds over the last year and shift the workforce and the investment into out-of-hospital care to support that pressure. And they've performed exceptionally well in terms of their standards. And again, nationally, this is something that's not been achieved elsewhere. So there's a lot of interest in how the system has done that. That's not happened in Plymouth. I can be confident in saying we've not been able to reduce any beds at all in Plymouth. We needed more beds of recent. But we are working to address our changes in our care model. It needs to be far more home first, and that's a key objective that we have in going forward. And that links into the accountable care system and integrating services objective in number 5, and also the no health without mental health. We're doing very well in terms of our development around those services. Our GP practices, most of them are rated outstanding or good. We know we've got some pressures within Plymouth, but we're starting to see some stabilisation of that now as a result of the NHSC, CCG and our provider support around that. We're also doing a good job in managing demand. So in terms of the number of referrals that we have into hospital, particularly for procedures, we've seen a reduction of 5% compared to last year. Now that is exceptionally good progress, and something that the rest of the country's not been able to do. There's a 1% reduction nationally. So we are leading the way in the way that we are delivering alternatives to traditional bed-based care again. Our regulator's view is that both CCGs have improved their annual rating, so we are now noted as making progress. And for our STP, we have moved out of being one of 3 most challenged areas in the country. So we are now in the middle of the pack rather than the bottom of the pack. And that's largely as a result of our performance, but also the fact that we're doing a lot better with the money. So we have reduced our overspend. We've saved over £25 million on agency spend, and we are on track to deliver the £160 million saving for this year. So we're making very good progress against that. There's a highlight about feedback from the regulators. I didn't particularly want to go into that in too much detail. It will really capture what I've just described around the top 10, but happy to take any questions. And we are in the process of doing our strategy refresh for our plan for next year and our integrated care model. So I really would be happy to take any questions in relation to those areas.
Thank you very much. Can I just ask you to clarify something? Have you got a timescale for the getting to an accountable care system within Plymouth?
We have an ambition as an STP, so ideally we wanted to be starting in what we would call shadow form in April next year. The message that we've had from our regulators is that they support our ambition for local accountable care delivery, whether it's an ACO or whatever we call it. However, the message is also very clear that we have to deliver on our commitments, both performance and financial, in order to be given the mandate to be able to do that. So I think the clear message we've had is house in order first and then proceed. However, we have made some real progress in the Plymouth system in the last few weeks alone, from commissioning and provision, that we think sets out a very clear roadmap for an accountable care organisation which could begin in April 2018. And we've committed to taking that plan to our January governing body as a CCG, which is our commissioning intention, and then we would go out to the providers straight after to agree a 2-year roadmap that would deliver that for us. Actually, the main objective is to try and get there by March 2019. So that's what we're aiming for, and we're confident we're making good progress around that.
And then one of the things that we've always been concerned about is the fair share budget. How are we sort of getting on with that and making sure that that's sorting?
Yes, so that is firmly in sight of the STP, and in the description of what we're doing around what's called the strategy into action process, it's essentially our strategy refresh. All 4 localities have been asked to look at their opportunity around how they can achieve their savings objectives. And that will mean that there could be potentially variation on the delivery of those savings. So you could expect more from one area and less from another area. We haven't bottomed that out as yet because we're in the middle of doing it, but it absolutely addresses the need that we need to equalise the expenditure. So North, East and South Devon are doing their plans of opportunity. We'll match them against Plymouth, and then we'll have to have a discussion about how we make sure that you move where required.
We know what's going to be on the work programme, don't we?
Yeah.
Right, I have Councillor MacDonald, then Councillor Tuffin.
Thank you, Chair. My question, Rob, relates to page 9 on my papers, which is the Devon STP top 10 developments and successes. I'm looking at point 4, the best bed is your own bed. Well, not necessarily if it's 5 floors up in a block of flats. And your mobility is very poor. So the housing tenure, housing type in Plymouth is completely different to that of Devon as a whole. You don't get in your leafy villages too many sort of blocks, do you, without lifts. The classic style flats that we see, particularly on the west side of the city, where health is poorer. So the point I'm making here is, what is if you put people in their own beds in their own homes, where you can, and that's less so in Plymouth, what has that done to the adaptations budget on social services?
So I can't answer in terms of the impact that that's had to the adaptations budget, but I can certainly get that information to you. I think we do need to balance the position of the housing situation in Plymouth against what you've actually done as a city. So what you can point to in Plymouth is a clear investment in things like extra housing care. Now, you can't point to that in other parts of Devon. So where you might have different responses, that has actually borne some fruit here within the city in terms of the way they've managed that particular opportunity. The other component that we need to bear that in mind in relation to the bed is your own bed is your best bed, is that within the Eastern, Northern and South system, they have had a lot more beds. So they have had an inflated amount of community beds in particular. So they have had the opportunity to think about how they redress that. That's not happened within the Plymouth system. You'll know that we're in a very heated system at the moment, and we've had to use more beds, in all honesty. So the objective around the model of care is consistent, but the way of getting there is slightly different.
Just a quick follow-up. What impact, if you're in a hospital ward, you've probably got, if you're lucky, 2 or 3 nurses and maybe 28 patients in a classic Derriford ward. If you go into the community, it's 1 member of staff to 1 total in a home and off. So what has been the impact on the community services of this method of care?
So in the North East and the South approach around the model of care, whether it's an acute bed or a community bed, they've focused on how you ensure for patients who are medically fit that they don't remain within a hospital bed. And that's based on the hypothesis of, which we broadly support as an STP, and we support this in Plymouth as well, any patients who experience delayed and longer lengths of stay in, whether it's acute or community, are at risk of what we call decompensation. So they might have very intensive nursing and support for more time in a community setting, but we know that in terms of their independence and being able to get back to a point of independent living in home, a community hospital or an acute hospital isn't necessarily the best environment to do that. Home-based care is by far the most effective approach to that, and that's consistent across the whole STP.
Chair, just finally, would there be any formal impact assessments? I think we all accept that probably home, getting out of hospital would be clearly financially better for you, may well be better for patients, assuming the home conditions are okay. I wonder if there's been any impact assessments on the need for an increase in community staff to cope with the beds, the extra beds of patients in their own homes, often quite isolated without people living in that house to help, and that the impact assessment on adult social care in order for an increased need in a package of care post-discharge, where normally, particularly, they might have stayed longer in hospital and been fitter and more able when they returned.
Yes, absolutely.
Can I just come in there? Sorry. I mean, this has all been agreed over the last few years, and certainly that's all, as my understanding is, that's all well in place for all of that, and I don't think you'd be disagreeing with that.
No, and it is a hypothetical question because this hasn't happened in Plymouth, obviously it is in the other areas, but yes, absolutely, risk assessments and impact assessments have been undertaken. We're very clear where capacity is closed, up to 50% of the cost of the wards is reinvested into the community, and we have clear standards of quality and care and expectations from that change that we can evidence.
It was Plymouth I was focusing upon because it is so very different from Devon, and we need to know the impact, not just on Devon, but specifically for us, because we represent Plymouth.
Councillor Tuffin.
Thank you, Chair. I mean, you did cover it, but I'm particularly interested in accountable care system, because I'm a great champion of integration, believe you me, and I can see the benefits of it. But I'm unsure of the mechanics of how this will work, and I think as a member I would want a little bit more understanding, particularly of the governance, because obviously as local councillors there's a degree of democracy that we have to adhere to, and I really need a bit more information, and I'm not expecting it today, but I think at some future I really need to know the mechanics of how it will work, and I understand it's progressing rather than a plan already. The mechanics of how it works, the governance, and any democratic input from our perspective.
Yes, I completely acknowledge that, and we would require that from you because we're going to need your support around the development. I think it's a staging thing, so in the first instance our objective is to bring together the parts of provision to work together, but then as you build that into accountability in a framework, you're right, you need to wrap around really good governance and you need political contribution or oversight. We need to agree all of those things, and we don't have a blueprint for that, so co-design will be the key in terms of how you can contribute to that.
Councillor Tuffin, I think we make sure that it's a recommendation that goes into our future work plan, that we are making sure that we get that slot for the right time.
Thank you, Chair. Thank you.
Of course, don't forget you can use your pressure on as the member of the Health and Wellbeing Board. Councillor James.
Thank you, Chair. And Rob, thank you for your presentation. I'm just wondering, we all know that agency staff can be quite expensive, and that concerns me a little bit. It concerns me as much, do we have the skilled workforce to deliver the STP for a start? Could you tell me how dependent we are on agency staff, and are there any particular areas where we have those concerns?
We are quite dependent. It varies across the STP. From a Plymouth perspective, we see some real pressure with nursing. So because we have a lot of additional beds open within the system, that can range from a minimum of 50, it can go higher than that. A lot of those areas are reliant on agency staffing, so that's quite a prominent dependency. There are other key areas, so we have some medical gaps within the acute hospital, also within mental health services as well, and that can range from junior doctor level and it can also go up to consultant level. There are also some key specialties where we struggle to recruit to, so radiology being one, but we see some real pressures across some other areas of what we would call core medicine, and surgical specialties as well. So that's been one of the real reasons why as an STP we've said that we can't really face this in isolation, because what we found was that you could have a situation where the RD&E was pinching all the people that Derriford really needed, or vice versa. And so we are working to get a composite workforce plan across the whole of the STP. But in doing that, stage one was around this mutual support arrangement to stop that kind of robbing Peter to pay Paul going on, and to make sure you share workforce where possible. I would say we're at the beginning of that, so we probably haven't gone as far as we need to at this stage, and we're going to see some of those pressures emerging in winter, so it would be a test of our agreement. But we are making progress, and I think we're one of very few areas whereby we've been able to do that, rather than having to say we're stopping the service and all those patients are going to have to go to Exeter or Torbay or vice versa. So we've made progress.
Yeah, I'm glad to see you're making progress. It's still obviously a concern for all of us, you know, if we're going to deliver this STP. So you have a workforce plan?
We're developing a workforce plan. So we've got a baseline, and we understand where our pressures are. And we know we've got some specific vulnerabilities. We've got some issues across the patch, and we're in the process of aligning that workforce plan to the clinical pathways that are needed. So the acute services review has helped with that. It's helped us think about how you can get things like your obstetric services or your stroke services better connected. So we're making good progress with that. We need to take the workforce plan to the next stage. And for Plymouth, what that really means is that for Livewell, for the primary care system here, and for the acute trust, they also need to develop a joint workforce plan, and at the moment they don't have that. We're doing it at a much higher level as an STP.
So finally, I think, Rob, is there any possibility we, as a scrutiny committee, could have a sight of that workforce plan?
Yes, we can certainly get you updates. We've got a workforce group as part of the STP, so it will cover off the areas of focus, because it also includes things like new roles and how we work with the Deanery and Health Education England to get plans in place where we know we can't just pick up, say, nurses or other disciplines. So yeah, we can bring that update to you, no problem.
So within that workforce plan, are you looking at what effect Brexit's having on recruitment, etc.?
We are where possible. So we know that there are some key pressures being faced. In particular, some parts of our system were had benefited quite significantly from overseas nursing recruitment, as an example, from both Spain and Italy. We don't have that now. And we probably see a diminishing European nursing workforce within the STP, as we do within a national context. So we are looking at an impact assessment of that. That is against the backdrop of what is already a pressured workforce. So from a nursing perspective, we're already looking at how we can look at non-registrant roles to support and how we can preserve registrant nursing time, particularly to focus on what's really needed.
Rob, it's me again, I'm afraid. I see we've had quite an overspend at one time, and you're reducing that, which is really good. How do you intend reaching a financial balance by the end of 2019-2020? Have you any ideas? I'm saying it's very nice to see you're going to do it, but what I'm saying is, are we going to see any cuts to services? If there are, will there be any impact assessments, which is already going to be done?
Yes, yeah.
I'm intrigued to know how you're going to get there.
So absolutely. So we've already made good progress. So the fact that parts of the system have been able to reduce the number of beds they need has delivered some financial return to us. And it's even though we've been able to reinvest some of that money, we've also made some savings as a result of that. We've got lots of other work streams which are also part of our financial plan, and in going forward next year and the following year, we will be doing a lot of what we're doing at the moment. So that is about better use of our medicines, what we would call medicines optimization, trying to prevent people going into long-term institutional care by getting them the proper level of independence modelling care that they can have, which we're seeing good benefit from. A reduction in the number of beds that we need, because we still feel that we have too many beds in our system, and at times that's doing harm for our patients, but also in managing our elective demand in a better way. All of those initiatives aren't in the absence of recognising that we need to do more as a health and care system to make savings that don't impact on patients. So we are looking at how we reorganise ourselves as organisations, and Plymouth is a good example of those organisations coming together, looking at whether you can share services, whether that's back office, IT, corporate function, reducing the number of boards we have, and we're making really good progress in that. The two CCGs have obviously come together in the first step, and they've made some very significant savings as a result. So we are doing things that mean that we are more efficient organisationally, rather than all of these things having high level of risk of implementation that can affect patient care. And anything that we do, we are obviously doing impact assessments and quality impact assessments against.
And I suppose we're all keeping our fingers crossed that the flu epidemic will not hit too badly for staff, let alone patients. Okay. Rob, thank you very much indeed for coming along this afternoon. We appreciate that we're going to need, I'm going to say, frequent updates. I noticed there was something about monthly updates in the beginning bit. I mean, obviously we don't meet monthly, but if there is anything that we need to know, please send it on to Ross or Amelia, and then they can let us know, and we'll take that forward from there. All right. But thank you very much indeed for coming along. We appreciate it. Take care. Right. Since we've got a couple of minutes before, well, we're just about on time anyway. Any other recommendations that you wanted to bring forward while we're thinking about it? Sue, can you put your mic on, please, now?
I do remain a little concerned about, in terms of a system-wide approach, that where you save money in one organisation, it should not impact to the detriment on another part of the system. And I use the example of adult social care and people coming out of hospital early to their own homes and not requiring maybe an adult social care package that would have been increased. And I spoke of impact assessments, and so did the speakers, speak of those assessments. We haven't been presented with any on how that's going to happen in practical reality. And I will say again that Plymouth is very different from Devon in that respect.
Okay, Ian?
Yeah, the point I made, I think we need an early overview of the accountable care system so we can really understand it, because to me, at the moment, it's just words, and there's no kind of flesh on the bones of it. So I think we really need to understand it going forward, rather than a fait accompli, oh, this is what we got. So I think as much information as we can get, not necessarily a report to meetings, but individual members get that information.
Ross, do you want to take that?
Yeah, through you, Chair. So there was a couple of things you mentioned there during that discussion. Accountable care system, and I think the road to that sounds as though it might be quite long if we have to reach balance before we're going to be allowed to move forward with that. 1920 is in the paperwork, so we'll schedule that for next year in the run-up to being in balance and having an ACS. Same goes for the capitated fair shares budget, I think. It's a question you asked, Chair. And finally, the workforce issue. So if we arrange for those to be scheduled into next year's programme, and we'll start thinking about that probably in the summer next year now, given your schedule will be quite tight in the early part of the new year.
Thank you, Ross. Thank you, Chair.
And you put something forward about the workforce plan as well, didn't you? Excellent. Okay. Right. Okay, we'll move on now to health and wellbeing hubs, which are pages 15 to 38 of your pack. Welcome to Ruth and to Rachel. I'd expected you here for the dementia one. I hadn't even put two and two together that you'd be here today. Right, that explains why you came so early. I was thinking, straight really. So, you've got a presentation in your packs, which hopefully you'll have gone through, but the floor is yours.
Thank you. Rachel and I are going to share the presentation. So wanted to bring you this update around health and wellbeing hubs, which, as you will know, is part of the action plan for the integrated system, the wellbeing portion of the integrated system. So you might just to refresh why hubs. This came really from many conversations, which I hope chime with yourselves, where we know that people often struggle to access the right kind of services that they might need at the right time. And by services, we mean across that really wide breadth of everything that might support people's well-being as well as their health. There are many things that are going on in our communities, many community and voluntary sector things happening that people may not be aware of. And so what we wanted to do with hubs is to try and breach that gap and try and make sure that people are connected in to those services that can support them to support their well-being and support them to remain healthy, and should they have some health problems, to support them in living as good a healthy as well and happy a life as they can with that. And we know that people who have perhaps some health and well-being challenges, they often have many challenges in their life that impact on that. These might be around the social determinants of health. They might be about housing, about financial security. They might be about isolation and loneliness. And we know there are things out there to support these people, but they can be quite difficult to access. And so what we wanted to do is to improve outcomes from patients, as you can see here, to improve population health, improve people's experience of healthcare, and overall this is looking at reducing inequalities in our population as well. So this chimes very well both with our own system-wide integrated health and wellbeing aims and the NHS 5-year forward view aims. So what is a hub? Well, it's around a network of integrated resources. So as I've explained, it's about bringing all of those things in the community together to make them easily accessible and to link people in with what they might need at the time that they might need it. The services could be provided through community members, volunteers, paid staff across our public sector services, a whole range. And there's also a recognition that there's no one size fits all, and each area of our city, each community might have slightly different needs, and so we need to be aware of those and responsive to those. So what we've done, press the wrong button, we have been working under the Wellbeing strategy, and we've set up a task and finish group to pull this work through. But also, and most importantly, this has been about co-production and co-design. We have a Wellbeing system design group, which has many members from our community and voluntary sectors, from our provider services, from GPs through to the hospital, and obviously commissioners and public health. And we meet regularly, and we all work together to try and develop the vision of hubs and to try and develop what they would look like and what they should feel like. We've also consulted with a number of other groups of people. So, for example, Mental Health Programme Board, Complex Needs groups. And then we've also recently done a consultation with the community and with some community groups, which we will cover off later on. So far we have done some work to describe what we think that hubs should look like and to talk about how we would deliver them. We've done some work to describe the mix of needs and assets in our communities. So the starting point is that Plymouth has a wide range of different assets in the communities already. We're not starting with a blank sheet of paper, and it's really important to recognise that. We absolutely want to work with the people that are already providing something that feels a little bit like one of these hubs, and help them to grow and not suddenly replace something next door. There's no point in adding something in that isn't required. We've looked at how our commissioning resources across the wellbeing end of the strategies align to hubs, and how we can better ask our providers to work with us on making sure that services are out there in our communities and available to them. And we've also identified a number of potential hubs that we can start work on. You can imagine this, I know we tend to always describe things as a pyramid, but you can imagine this as a universal offer, which is the bottom base of the pyramid. So many people might have a need for a little bit of support, a little bit of information. And so we're working to make sure that all of the places where people go for other services, like pharmacies, like libraries, like GP surgeries, children's centres, those kind of places, can easily signpost in to the right services. We have a next tier up which is targeted, and this is around building places that people either already go to or that we can grow the offer, and providing certain services in those locations. I'll give a bit more detail in a second. And then the top end of the pyramid is around where health services are already provided, and making sure that those links through to social care social determinants and well-being is also provided in those locations. So I think I've described that probably suitably. The Universal Hub Network is going to be, it's around the advice and the information and helping people to access information. We have a network of workforce development that's going ahead at the moment to make sure that people that are in those places, for example our libraries, know how to access information, signpost people to it, and give people a little bit of information and advice to support them in that. The targeted hub network is probably the one that we're focusing the most attention on, and what we have been doing here is developing this mapping and this network of what we need to do. And so I have some, I'm going to move that through. So there's a slight lag when I press the button. So we've been developing our neighbourhood profiles, and you'll be familiar that we do neighbourhood profiles around need, around health and social care and well-being need. What we've then done is matched these with assets. So we've identified the areas in communities where there are community buildings that people go to access support. And what we've been looking to do is try to identify some of the gaps in Plymouth. Where do we need to try to either boost something that's already there or stimulate something perhaps new to be developed. When you map this, you can see that the colours on that map loosely align to three categories. One of them is red, and this is where there is high need, but there's also a lack of assets. There aren't that many community assets. There are some, and they're marked on by the blobs, which I know you can't see from this from this distance. But potentially we need to develop a little more in those. The yellowy amber areas are areas where there is high need, or at least moderate to high need, but there are already quite a lot of community assets. So in those areas, we want to work with the existing assets and build them and see how we can best make use of what we've got. And in the green area, these are areas where we have somewhat lower levels of need, but there is still need there. They would still benefit from this. And so our aim there is to take up opportunities when they arise. So we have some examples of some of the targeted hubs, locations that we've identified as being potential areas. And these are the areas that we went out to consult on. They're not saying that these are the only things that could be considered. They're not saying at this stage that they will all become one of these targeted hubs, but these are areas that we're working on. So as you can see, in the north locality, Ernest Settle Medical Centre, Four Greens, and Derriford Hospital is also obviously a place where you already have the medical services, so we would want to wrap in those social and wellbeing services as well. And we're also looking at a slightly wider range of sites through one public estate. In the east of the locality, we're particularly looking at Reece Centre and looking, as I say, we're looking for opportunities around this area of the city to see what we could build on. And one of the things we're doing as well, of course, is working with our GP surgeries to see where could we make sure that the GP surgery can make sure that they have all of the access to these services as well to signpost people to. In the south of the locality, at the moment, we're looking at Ernest English House, Efford Youth Centre, Manamead Centre and Catdown Primary Care Centre as potential locations. And again, as I say, one public estate we are linking with as well. And in the west of the locality, the identified sites at the moment are around Tamar View, the Beacon, Jan Cutting Healthy Living Centre and Stirling Road. And we already have put in some services into Stirling Road because to support some of the issues we've had around primary care there. And again, one public estate, there may be opportunities to look at some other locations through that. So, specialist hubs, as I mentioned, would be aligned where we already have some medical services. So obviously in the city, these would be Derriford, Cumberland Centre and the local care centre. And just a mention that, of course, this is covering the western locality footprint and so is wider than just Plymouth. And so there is also, excuse me, consideration around South Hams and West Devon. So Rachel's going to mention the community consultation that we've just done.
Yeah, so we actually commissioned Health Watch way back in August. They've been carrying out quite a long-term piece of consultation for us over 4 months because we thought it was really important that we had an organisation carrying out the consultation that was kind of seen as kind of separate really from the council so that we got a really good view of what people were thinking. And the aim of the consultation was twofold. It was to check out people's perception of the proposed buildings that we had on our, that we came up with as Ruth has described, and also to look at what the people thought of our proposals for services that we might be providing in those targeted buildings. The process was quite broad. We had we had some consultation events, one in each of the neighbourhoods which around the targeted building hub, and then we had on top of that a lot of community level engagement to gather views of people who wouldn't necessarily go to those events and who might not necessarily be connected to those buildings as well. So they went to all kinds of places, including shopping centres and outside schools and all kinds of places. They spoke to a lot of people. And also we wanted them to identify key members of groups or groups where they could engage with people who from specific groups, and we'll come on to them in a minute who they spoke to, specifically people like carers, people with disabilities, faith groups and so on. So we asked them to do quite a broad range of consultation, looking at the wider public, but also members of groups where they would have specific views around the hubs. Press the wrong button. Yes, thank you. Having trouble moving it on. Okay, so they contacted quite a wide range of groups, but actually managed to go and speak within the 4 months to 13 groups in depth. And that was in total 165 people. And I really like this description because one of the groups came up with a description of how they see the problem at the moment. And I think this really summarises what the issues are. So they said that services at the moment were fractured. It was hard for them to get accurate information on what's available. And services are divided at the moment by disability, and the help that they get is not necessarily holistic. So I think that really describes what we're looking at in terms of wanting the hubs to be somewhere where you can get help regardless of your mental or physical disability or need, and the information is actually that is there is accurate and helpful. So that we found that was really, I really like that summary of the issues at the moment. But the key themes, so I'm going to just run through some of the key themes from both the group consultation and then the locality consultation. So first of all, to say that there was an overwhelmingly positive message about the principles and ideas of the idea of the hubs from all of the groups. They thought that this was really good. These were really good proposals. So we asked them about the buildings, what they thought they'd need from the staff and from the services. The buildings, I think none of this is really a surprise. They wanted the buildings to be quite obviously accessible physically. It was important that they were on bus routes, but also important that they had parking and the signage. I mean, these kind of things that we would do anyway, but the signage would be really clear and easy to read, and an easy read as well. The staff, I think this is really good because it emphasises what we've already thought ourselves, but I think it makes it quite clear that the staff need to be very well trained. They need to be very knowledgeable about what's available across the city and in the localities. The staff need to be consistent so that you always get the same person or people on the reception area or whatever. They need to be non-judgmental and not too formal and very welcoming, which I think is what we'd want from a hub. That's how we would envisage it to be. And then the services, we gave them a list of services things that we were thinking should be in the hubs, and then also asked them what else they would like to see. And in terms of priorities, they prioritised, interestingly, the first one was knowledge of local voluntary and community activity. So it's really clear that, as we've said, that people just don't know what's out there. There's lots of things happening in localities. We're not even aware of a lot of it. So that's what people want to know. But they also want other things that you'd imagine, things like benefits advice. Support for long-term conditions came up very strongly, so people wanted information and advice, support for self-management and also peer support, and then things like mental health support and advice and volunteering and debt advice. So I think this has been a really helpful exercise because it emphasises that some of the things that we think, what people want actually came across in the consultation. Very strongly, people felt that loneliness and isolation were very important issues, and mental health came across very clearly. So I think these hubs need to be places which are very much about social inclusion, things that are happening that people can join in with. Reducing loneliness is a really key theme, came out very strongly. I really like this particular quote we got from, came out of several of the groups actually, but I think it's really nice. It summarises, people said include us, see us, listen to us and give us time. So I think that's a really nice summary of the approach we need to take. And then really positively, people were offering to volunteer. So they obviously thought, actually we could come along and volunteer in the hubs. So it's something that they would see as their own buildings as well. And so the locality-based consultation, I should probably say that we did as well get overwhelmingly positive feedback. And, the reports show that when people were asked, would you use a hub? A large proportion of people said yes. Over 2,000 people were spoken to. They did a long questionnaire with 651 of those people who were prepared to sit down with them and fill out a questionnaire because it asked quite a lot of questions about each of the localities. But the key themes, quite honestly, were very, very similar to the groups. So people were saying, about accessibility, transport links. Interestingly, people were saying, it'd be nice if there was a cafe there. I guess that makes it more informal, and people like the idea of sitting down and having a cup of coffee. And the same things for the staff, being friendly, knowledgeable, and a good range of activities. And then very similar priorities, again, knowledge of the local voluntary and community sector, health improvement and benefits advice, and mental health support. So although there was a consultation took place in every locality, and we have 10 reports of those, these were the themes that were very common. They were common to all of them, so that's very interesting as well. And just wanted to point out that because we were consulting people in neighbourhoods about buildings in neighbourhoods, we didn't ask any questions about the city centre, but that's because we think the city centre needs to be developed as a separate offer, because it's really going to be available to the whole city. So that wasn't there wasn't a separate consultation around that. So, yeah, the hubs buildings, so there was very strong support for developing some of our current medical buildings to include more wellbeing. So that went down really well. People were saying, yes, that would be really good. And they very strong support for all of those three localities, having more of a wellbeing offer. The other locations, the hub buildings, on the whole, they were very balanced support. So we didn't get, very many where they said, we don't like that one, we only want that one. So we are going to be looking very carefully at that, analysing that in more detail to come up with our proposals for which buildings we choose. So the next steps are to consider which buildings, based on our... We've obviously done a lot of work over the last few months looking at the feasibility around each of the buildings and how accessible they are. So we need to revisit that and combine that with the consultation responses and then prepare our report and our recommendations to Cabinet. So that's the next step, and obviously it's really important that we choose the right buildings because they need to be used by the public. So the final page is, you can't really see it very well from here, but it's basically an implementation plan which says that we're expecting to go to the Cabinet in January, and then we will be developing our first targeted hub buildings for March. And some of the other commissioning work on there is already taking place around device information, health improvement and wellbeing. So we're already developing the offer in a very co-productive way with the providers. So we're working with... I've just come from a meeting just now with the providers of the wellbeing services, and we had a very exciting discussion about how we're going to get to our first hub in March. So so that's the timetable. That's it then.
Thank you both very much. I've got questions wanting from Councillor James and then Councillor Bridgman.
Thank you, Chair. First of all, can I thank Ruth and Rachel for your presentation? Very helpful, quite honestly. I believe that Health Watch actually was commissioned to carry out this a consultation process. I actually attended some of the meetings, in actual fact, and I found them very positive, quite honestly. And most people who I spoke to afterwards were fully in agreement with these hubs. They thought it was a good thing, but if it helped their health and well-being, it had to be good, helping them to improve it. My question, actually, in fact, is around costings. There has to be a cost to all this somewhere along the line, and I wonder if NHS England will be offering any financial support towards these hubs, or if not, where's the money coming from?
I think it's really important to emphasise, because I think there's something that, as we were doing the consultation, it became clear that people were asking that question about where's the money coming from. And actually, what we're doing is we're using commissioned activity, that services that we already commission, we're actually using to remodel, so that we create an offer in the hubs. That's money that we're already spending on services. And we feel that, in effect, by doing that and by combining services together in this new way, we should be able to create a more efficient model. So, just to give you the headlines, what we've done is we've reshaped our health improvement service. There was a new contract awarded in October to Live Well South West, and they are going to be very much developing their offer into the hubs going forward, because that's their new contract. Advice and information, very similarly, we've worked with our advice provider, Advice Plymouth. We've reshaped that service. They now have a caseworker service, and the caseworkers will be doing outreach into the hubs. And they're also rolling out workforce development, so they're doing a lot of training, and as Ruth touched on earlier, they're providing training to other organisations who will be able to do advice and information in the hubs. And then the final piece of work for now is around wellbeing and prevention. We have a range of services that we commission at the moment, and we have a group of we're meeting together as a co-design group, and we're actually working on developing the model for the hubs of those prevention services. So, for example, befriending, time banking, volunteering, stroke support, mental health support. Those are things we already commission, and what we're saying to them is we want you to work in a different way. We want to work in a neighbourhood way, in a place-based way, rather than... We don't want you to be that idea that people who would have to have a certain condition before they get support. We need to move away from that, and everybody who needs help should be able to get it. So we're working with them very much to develop that model. So it isn't actually about any new money. And the other thing is, of course, the buildings are a range of buildings that are owned by different organisations, and they're quite willing to work with us in partnership to use their buildings. Some of them are council buildings, but some of them are not. So this is very much about partnership, and we've so far it seems to be going well.
Can I just say I wish you every success in this, because I think it's very essential for those people out there living perhaps independently who need these extra services which you can provide. Will merging of GP practices help at all? Will the merging of GP practices help towards this?
I think that falls into one of the categories where we'll use the opportunities that might become available. So if there are GP practices that are reviewing their buildings that they're using and that perhaps are merging or something like that is happening, then we'll want to be talking to them about how we can come alongside them and grow that. But actually at the moment, we would hope, and we will be, let's say hope, we'll be making absolutely certain that every GP practice knows where their locality hub is, and we'll just signpost people there anyway, whether they're a small practice or a large practice.
Councillor Bridgeman.
Thank you, Chair. I've got a couple of little questions. My first question is on page 25, the map. What do all these little tiny numbers mean?
We're just struggling because our pack we haven't got that pack up. Is it on there?
Yeah,
Yes.
on all the maps, there's like little tiny numbers and all little coloured
You haven't,
circles.
unfortunately, you haven't got the key. Yeah, so the key, which is obviously will be in the document, lists all. We've broken down the types of assets into different assets. So we've got GPs, leisure, community assets, job centres, specialists, and in the key it explains, and those are numbered, and then it explains what all those buildings are. So apologies, you haven't got the key. I've just realised, but it will be in the final document.
We can send.
Yeah, we can send that.
Yeah, we can send. Thank you. And my other question was, how are we going to be promoting this and marketing it to residents? Because it sounds so good, and it could be so fantastic. But people need to know about it, because if they don't know about it, they're not going to use it. And will you gather feedback from people to see what works and what doesn't work, so you can keep improving the service? Thank you.
Yes, absolutely. So I think the way to promote the hub is going to be in that community that's around it, and making sure that people around the community leaders or people that are engaged in the community are aware of that hub. So I think the campaign will be quite targeted. We're not going to be opening all of the hubs on the same day. So although we'll hope to get press, across Plymouth, a lot of it will be tailored to that local community. So we'll be coming to yourselves to help us to promote that. What we'll then be doing as well is to make sure that people who are already working in that area in any kind of health, well-being, community and voluntary sector, GP practices, etc., that we're making sure that they're all aware of it. We haven't finalised plans, but we're hoping that there will be, we will develop a range of materials so that people can have like a little credit card sized card to give out to send people, tell them what they might be able to access there and access them that way. I think the evidence from other areas that have done not quite the same thing but similar types of models has been that it grows. So you have to start to deliver something and show that it's there, and then community members start to use the services, and then word starts to spread. So we'll be trying to push that as much as we can, but there will be an element of trust developed in the community, I think, when they start to use it. And yes, we will absolutely be wanting to take feedback about what have they found helpful, what haven't they found helpful, would they come again, would they recommend it to friends to come to it, to help us to shape these. And we know that that the local offer may have a slightly different flavour in different areas of the city, and we know that, and we want to make sure that we respond to that.
Councillor MacDonald, then Councillor Tuffin.
Thank you, Chair. I'm glad the issue of a key has been raised, thanks to Councillor Mrs Bridgman. In the East End in London in the 30s was what was called the Peckham experiment, and it was in fact the precursor of a healthy living centre, which strikes me as this is very similar, but it's now called a hub. So the language has changed, but the principles don't appear to have done so. I do wish that this one will survive. at the moment, you've got hubs in geographical locations in buildings. In terms of a 21st century approach, and a card was mentioned, I'd like to be able to stick a card in the wall and a screen comes up and shows me what is available without the necessity of me walking from Stonehouse over the hill to Devonport. Because I think that way you've got people from the outside coming into a hub. I believe that the information should be coming from the inside out rather than always outside in, because your model, like Derriford, you travel up a road and you go into a hospital. As far you could be seeing some of your results on a screen in your GP surgery, which is inside out. So that's just one example. And I think we should be doing far more of a 21st century approach. So I would like a card, slot in the wall somewhere, and I can tap arthritis or whatever it is, and then I can see a list of community organisations, a list of services, a list of dietary recommendations just by tapping. And you could do that on any laptop anywhere.
So absolutely, and I didn't go into great detail around the universal. So what we are talking about in the universal is having that online offer. So based on the Plymouth Online Directory, but a new and improved way of accessing services through that. So that will be something that individuals can access on their own, or people can support them in accessing. So for example, a pharmacy or in a library, they would be able to access that range of services through this online tool. So absolutely.
Thank you. Just finally, Chair, one of the problems with this, of course, is that nobody's paid to update it. So you tap on an organisation, you try and find it, and it hasn't existed for about 2 years or something.
Yeah, I've just come from a meeting, actually. We've been discussing the whole website offer, and I agree, it definitely needs to, we need to prioritise keeping that up to date. It needs to be resourced properly. I think that's important.
Okay, I have Councillor Tuffin and Councillor Toohey then calling quits to this.
Thank you, Chair. Really good report, and it sounds very positive, and thanks for that. I noticed you kind of said that the plan will follow the need, which I'm really pleased to hear about. But presumably, you'll have locations with a really huge need without the necessarily facilities already there, be it commissioned or buildings. So I just wonder how you prioritise that, because it would seem to me there's areas of poverty and deprivation in Plymouth which are really crying out for this service, perhaps earlier than others. And could you possibly say how you would deal with that? Because I understand you may be faced with an easy plan in A, a difficult plan in B. So perhaps you could expand on that for me, please.
So what we have taken that into account when we've looked at that map against the assets and against the need. So where there are areas of the city where there's high deprivation, a lot of the time we've already been doing work around there, and the hubs, sorry, not the hubs, the assets that are already available can be built on to do this already. So we have taken that into account, and you're right, there's a little bit of pragmatism about how difficult or costly or challenging would a hub be to develop, and therefore how quickly can we do it. But we are still going to be working on it, however, even if it is a trickier one to do. So we are trying to match it to need. I do think there are, especially when you go into smaller and smaller geographies, there are pockets where there is an absence of an asset and there's a need. And we are, after conversations as well that we've had recently, we are mindful of that, and we are trying to understand the flow of the community and where they might go to and how we can build that offer. But you're right, it is challenging, and we can't say that we're going to have a targeted hub absolutely everywhere where we might want one. But we are trying to do that, look into it into more detail, and make sure that communities have got an offer that meets their needs. And it's also probably just important to note that some of the needs that we're hoping to address here aren't just about deprivation. They might be around an ageing population, and the fact that if we can help them to access better healthcare then, and keep their health and well-being better for longer, then that actually eases pressures on the system that perhaps other people in other areas of the city may need to access more. So anything that we can do to relieve the services that are sort of higher up in that pyramid, the better for everybody and the better for tackling inequalities.
Thank you.
Councillor Tui.
Sorry, thank you, Chair. I wanted to speak about the West locality. I've been looking at your map here, and in particular, I'm a member of Ham Ward. I have to say I find it a little confusing. There are two, looking at your key, possible hub locations, and then the potential ones. You've got the Beacon and Jan Cutting Healthy Living Centre, both in North Prospect area. And Jan Cutting Healthy Living is quite understandable. It's almost become a wellbeing hub on its own and has been working happily for years. The Beacon has got the library and the Shore Start Nursery, but pretty poor community use. I was a little surprised, but the main point is they're very close together, but there are large areas, say to the north of the western area, that you actually mentioned to Pennycross, where there are areas of deprivation and also a lot of older people who are suffering from social isolation, and apparently they have nothing for them at all. I wondered why that was.
Yeah, so the issue of the fact that the Beacon and the Jane Cutting Healthy Living Centre close together, I mean, we so these were the options that we have gone out to consultation around, and we are in the process of analysing the outcomes of that. So clearly we're not going to be developing two buildings in the same, very close together to the same extent, but because but we will be working with all of those buildings to make sure that we support them and where we need to do outreach, so that if there's a targeted hub building, do outreach to the other buildings if necessary. So there might be some outreach work going on in those other buildings. The other thing that we obviously have to acknowledge, and has come out of the consultation, is that each targeted hub covers what you'd probably consider to be maybe 3 neighbourhoods. So they are quite big localities, and we have said, yes, we do acknowledge that, but what we will do is, because we recognise that, is we will make sure that, again, we work with the kind of universal buildings in the area to do the outreach. So, for example, we'd have advice services going out into those other localities, because we haven't got the resources to do a hub building in every single area that we'd like to, but we will develop with those universal buildings that are there. So, as Ruth said earlier, the other buildings, the libraries and all those other places.
Comment? Well, North Prospect is arguably not as deprived as it was, and is in the process of becoming even less deprived, whereas St Pancras is not changing, and I would have thought rather more in need of help than the other area.
I think thank you for that feedback, and we're really happy to go away and look and see what we would have in the way of universal hubs and how we can link that in.
Councillor James.
Thank you, Chair. Rachel, you mentioned earlier on that there's could be no extra money for this. It's something money you're going to try to find out yourself to do this, and I wish you well in that. Can I ask you about the CCG? Will they be offering any financial help? Because some of the things we're looking at, and Councillor Tuffen's already mentioned, areas of deprivation, addressing inequalities, that's one of the key things from the CCG. So I'm asking you, will they be actually giving you any financial support towards this?
We are wanting to put we have a little bit of money that we are trying to put into this development. It's going to cost a little bit to get it off the ground. And as you know, we have an integrated health and wellbeing budget, so a decision around some of the spend that comes from that budget is jointly taken across the CCG. So this is absolutely coming from joint funding. Yeah.
Okay, folks. So, are we content to recommend this to Cabinet from us? I mean, the proviso to me is that it's something that needs to come back to us as it's progressing. I've got to say, one of my concerns really is the use of Derriford as one of the hubs. 'Cause, you know, if you think about Derriford Hospital as it is, there are so many people trying to get in, whether it's by bus or by car, that putting extra footfall into there perhaps could cause even more of a problem. But, you know, we look forward to seeing how this develops, and I know it's only a proposal at this stage. Yes, so we're happy to recommend to Cabinet, and as I say, the proviso is we will look and help and see how it develops. Thank you both very much. Rachel, you're staying. Ruth's getting away with it. Yeah. So can I then welcome Darren, Claire, and Anne Smith, please, to come and join Rachel. I don't know if the heating's on.
It's not very warm in here, is it?
I didn't welcome Jamie, did I, earlier on? But perhaps Jamie would nip out and see what's happening to the heating. Well, welcome. You're going to give us an update on a dementia-friendly city. And I mean, from my perspective, what's the last 6 years done for Plymouth since, you know, we launched it, in May 2011, didn't we? So, you know, what's that 6 years, how's that made a difference to the average Plymouthian who is suffering with dementia?
Yeah, so I'm going to introduce this and give you some of the background about dementia and about why we've got a dementia-friendly city, as Mary said, the history of that, and then where we are now. And then Claire, who's the dementia-friendly city coordinator, is going to talk to you about the impact of the dementia-friendly city. That's probably the bit you're really interested in, and some examples. And then we have our colleagues Darren and Anne who've come to talk about their particular examples to give you a flavour of what's happened for people with dementia, what an impact it's had. In the wrong button again. Okay. So just to give you some facts and figures then. You're probably aware there are currently over 700,000 people living with dementia in England, and that's predicted to rise by 2030 by over 1 million. But in Plymouth this year, there are around 3,319 people in Plymouth who have a dementia, and this is predicted to rise to over 3,500 by 2020 and up to 4,735 by 2030. So we've got a significant kind of growth in the number of old people with dementia, and that's partly to do with the ageing population. So interesting fact is that 1/3 of people with dementia actually live on their own. So while we talk about people with dementia, it's really important to recognise that there are lots of people living on their own who don't have carers or family living with them. And you know, it's quite just to give you a flavour, in the UK, one person is diagnosed every 3 minutes. In Plymouth, we have at the moment achieved around 60% diagnosis rate, but that's improving, and we're aiming for the government target of 67%, and we are on track to achieve that next year. So diagnosis rate is going up. So to give you the background then to why does Plymouth need to become dementia friendly? So as Mary said, it actually was launched in 2011, but it came out of some research that was done by the University of Plymouth, who talked to people with dementia and carers in 2010, and found that there was a lot of social isolation of people with dementia who felt they were unable to access services and organisations for support, and there was a lot of stigma around dementia at that time, and I think that's really changed now, but a lot of stigma around people admitting that they had dementia, not wanting to get diagnosed, and not wanting to tell people, and so people then become more and more isolated and more lonely, and significant rates of depression for people, both the individual and the carer. So that piece of research was quite a wake-up call, really, I think, to people to say, actually, this is really bad, this situation is not good at all, and we need to do something about it. So from that, in 2011, dementia-friendly communities were developed, But just to give you to sort of define what do we mean by dementia-friendly communities, or definition, and these are the aims of dementia-friendly communities. They aim to reduce social isolation, to empower people and include individuals, so being inclusive communities with people with dementia, to challenge the stigma. It's really important that people don't feel embarrassed and people understand what dementia is. So it's about raising awareness to people understand what dementia is about, and also to improve people's well-being. So those are the aims of the dementia-friendly movement. So so as Mary said, the dementia-friendly communities and the Alliance movement actually originated from Plymouth. So, and you were one of the founding members, Mary. So the Dementia Action Alliance was founded by a partnership between Plymouth City Council and the university. And then, since then, has been rolled out nationally. And just to update you, is that 340? Yeah, we counted up yesterday, and actually there are 346 dementia Action Alliances across the country now, so that's slightly out of date. But Plymouth Dementia Action Alliance has around 90 members, so it's very vibrant. And each Dementia Action Alliance member has to create an action plan to say how they will become dementia friendly. So they can't just sign up and say now we're dementia friendly. They actually have to have an action plan, and that will tell us, and that is then needs to be implemented. We've had 5, people are probably aware, we have had 5 international dementia conferences in Plymouth, so we're recognised nationally as a place of excellence for dementia. We've had delegations from Japan, China and Australia, so we've had visits several times of both dignitaries and also students, so we have got international recognition as well. And then last year, we were very proud to be named the National Dementia Friendly Community of the Year in the City category for this year. And that was at the National by the Alzheimer's Society. Just to give you a flavour of the types of organisations that are members of the Alliance, so we said there were 90, but just gives you an idea that there are all kinds of charities, taxi companies, university, city bus, the hospital, lots of organisations, Broad Brush Fire Service and so on. So just to talk about what the role of the dementia-friendly coordinator is, because I think it's really important to point out that we're one of the very few local authorities that actually employs a dementia-friendly coordinator. There are, I think, maybe a couple of others, but we are very much a pioneer in this, and in having that role. So in the last 2.5, and we have had the role for longer than 2.5 years, but in terms of telling you what we've been doing recently, I thought we worked at, Claire's been keeping a record of what she's been doing. So the role did exist before that, but in the last 2.5 years, Claire has run 201 dementia awareness sessions and managed to create 1,671 dementia friends. And because we have... you may be aware that there's a role called the Dementia Champion, and the Dementia Champion is able to train other people to become dementia friends. So we have other dementia champions across the city, and we'll hear more about that in a bit from Claire and the others. But there are a total of 14,000 dementia friends in Plymouth, which is a significant number, which we think we should be quite proud of, really. Claire has carried out 81 dementia-friendly premises assessments, and that's where she goes into an organisation and has become quite an expert at doing an assessment of the premises, and then is able to advise people on how to improve their premises to make them more dementia friendly. And again, we'll hear some examples of that in a bit, of how the impact of that. Claire's quite often brought into other planning departments, other departments, of the council, to talk about the built environment and how they can improve that. So she's done lots of work with the council planning department, and they see her as their dementia expert. She's done work to improve the council's the toilets across the city. She's advising on the development of the Box History Centre, so that lots of work within the council to support other departments. But she also supports a wide range of businesses and organisations to become dementia friendly, as we've seen, and she coordinates the Dementia Action Alliance, which is quite a large piece of work. And then in terms of the City Council, we have lots of parts of the council that have become dementia friendly and that have dementia champions. So Claire's worked with the parking team, we'll hear about that in a minute, public protection, arts and heritage, libraries, street cleansing and planning, as we've said, and the First Stop Shop. So a lot of those departments have had their staff have had dementia awareness and have become dementia friends. Claire also does lots of raising of public awareness and events, so she's been running stalls in lots of places, particularly around Dementia Awareness Week, and places like Drake Circus is a regular venue for having a stall. And when she's there, she meets lots of members of the public and raises awareness of the dementia-friendly city that way. And we get publicity through the Herald and on the radio and so on. In fact, you were on the radio last week, didn't you? So, yeah, we do that public awareness raising. And then recently a lot of work's been developing around GP practices, which we'll give an example of that in a minute, but also dental practices and students. So Claire's now working with the university and goes and talks to groups of dental students in several of the years. So they're really developing the dementia awareness amongst the medical students at the university as well. So I think I'll hand over to Claire to talk about the impact.
A bit closer. Okay, so in terms of impact, obviously I'm not going to read everything on all the slides because I know you've had the presentation sent to you beforehand. This might sound a strange thing to start off with, but I know how fortunate I am in the job that I do because I've had many different jobs, broadly speaking, under the care umbrella over the years of my working life so far, and never one where I see so much impact and get to hear about it like fairly regularly. I've done jobs where you hope and common sense tells you it's having a positive effect on people, but you're never 100% sure. With this, you can be sure that it's going on. So the examples that I'll share with you today, it's just a few examples. We had quite a problem seeing it all down for purpose of this meeting. So this isn't the whole sort of length and breadth of it because, you know, I haven't included anything in here about the impact of the Moments Cafe and Dementia Hub in New George Street, the impact of caring for carers and all the work that they do, Age UK Plymouth, Alzheimer's Society, because we really would be here for the rest of the week. And as Rachel said, Plymouth has a reputation now over the last few years for being a leading light, really, in this kind of work. And all of us that are involved in it in the city and our various organisations are kind of mindful of this. And with that, I think, comes a responsibility to make sure that we get it right. You know, it's lovely, isn't it, to get recognition and get awards, but that isn't really what this work is about. It's about getting it right for the people that it affects. And that isn't just the people that are living with dementia, it's all the other people that it impacts on, family members, carers, all those people, all very, very important. And striving to be a dementia-friendly city is a constantly evolving thing. So even though we won that award last year, it doesn't mean that we've arrived and, you know, we've got everything absolutely right, because I know that we are, although we're quite far ahead of the curve compared to other parts of the UK, we are not at a point yet where everybody with dementia can come to people like myself and Rachel and say, everywhere we go across this city, we feel fully respected and sort of understood and supported. We're not near that yet, but we are getting there and we're constantly sort of working towards that. So, Dementia Friends, that are part of the whole national initiative that the Alzheimer's Society lead on, when they pledge to be a dementia friend, they pledge to carry out an action or several actions that can be as simple or as complex as they want it to be. And at the end of each session that I deliver that is part of that programme, I invite people to become one. I give them suggestions that have basically come from people with dementia about the sort of actions they'd like to see people carry out, but it is very much then up to them. So they take that forward in their particular areas that they live in and organisations that they work in. Any member organisations that join the PDA, their impact is felt with their individual sort of pieces of work, which you'll hear from Anne and Darren in a minute about just some specific examples of that. And Plymouth is actually mentioned in quite a few different pieces of reports and guidance. So things like the BSI Code of Practice for Dementia-Friendly Communities in England and the 2017 Dementia and Town Planning Institute guidance that came out, we're mentioned as an example of good practice, best practice. which is brilliant. And also we share our practice, not just across the city, but across the UK as well. I mean, one particular example, just because Darren is here, I'll mention it, is when we put the parking spaces in, between us, we had inquiries from all over the place, didn't we? And this is no disrespect to some of these places. I got the sort of less glamorous ones. So places like Middlesbrough, Luton, Hull. I think you got somebody from Vienna contacted you about it. They wanted to know what we were doing and why and how we did it. And at the heart of trying to be a dementia-friendly city is it's about respecting and valuing people and helping support them with, you know, what they're telling us we need, because central to all this work is actually consultation on an ongoing basis, not just once a year, with people that are living with it, with people that are caring for people that are living with it. Because, you know, it's all very well if people like Rachel and myself sit there in an office and say, right, we think this is what we need to do. But if we don't actually ask people that it affects, how do we know that we're getting it right? We don't. So with that is a constant sort of process, really. Can we go on to the next one?
Yes.
I've done it right, okay. So you'll see some of the feedback here. The feedback at the top, that was actually from somebody that attended last year's Dementia Friendly Carol service. That was the first time that we'd done it in the city, and we've just had this year's one yesterday, actually, and we had over 100 adults attended that from all over everywhere, actually. You know, some people had come from care homes, some people had come by themselves, some people had come with, you know, partners, what have you, or friends. And what brought it home to me as well is I actually got talking to a lady after the service, and it turned out she was the same age as me, and she was diagnosed 2 years ago. And that just brought it home to me ever more how this condition is affecting people right across the age spectrum now. You know, it isn't just people 65 plus, although predominantly it is. There are people 50s, 40s, 30s, 20s getting diagnosed with it. So to be proactive like we are being in Plymouth, I think is absolutely crucial. Okay, another one underneath. This is just one example from City Bus. City Bus have been involved for a very long time. They have now ensured that every single member of their organisation is a dementia friend, and they always get involved in any of the bigger awareness raising events that I organise. And that's just one example of, there is a lady that they're all aware of, all the drivers are aware of, that lives in Tamerton Foliot. She has severe dementia, so the drivers, when they're in that area, look out for her and they make sure that she gets on the right bus and gets home safely. Without that awareness, I don't think that would necessarily happen. She'd probably just get overlooked. But there you go. Okay, so also, as it says at the bottom, I've done quite a lot of work with retailers, particularly in Drake Circus. And on the back of that and some of the events that I've done, and on some work that they've done around supporting people with autism, they've now decided, and this has just been a very recent thing, that they are going to offer once a month on a Saturday morning a sensory shopping hour, and that basically involves just being mindful of the impact bright lights, too much noise can have on people with autism and dementia. And, you know, they've got a briefing that will go round, and I will actually build upon that in the new year and go and do some more formalised work in helping support some of those retailers become proper dementia-friendly ones.
Can I point out you've got 15 minutes more for your session, and that's got to include questions from the councillors.
Right, okay, I'll speed up. So the next one, that is just some impact and some feedback from people that have been on some of the dementia-friendly shopping events. You know, it gets people out, gets them feeling less isolated, gets them continuing to do things in the community like they used to do pre-diagnosis. On the next slide, the top bit there, that top piece of feedback, that's actually from an awareness session that two of our other dementia champions within the council, Debbie Bendin and Hannah Williams, who work for the library service, did. And as you can see, the person was absolutely delighted. She said this might not be much to a lot of people, but this is absolutely huge for our sort of family. Let's go on to the next one. Okay, so this is another example from our concierge team at Windsor House. All the concierge staff came to some awareness sessions that I ran during National Awareness Week last year, and then a situation happened shortly after that where, as you can see, a gentleman wandered in, he had dementia, he was confused, and because of what they'd picked up and learnt in that session, they dealt with him in the most appropriate way, and I was really proud of them when I got this email. I thought that is what it's all about. Okay, so the next bit, I'm just going to ask Darren, if he doesn't mind, to tell you a bit about the work that his team have done.
Thank you, Claire. About 3 years ago, I was approached by the member for St Peters and Waterfront, Councillor Tuffin and Claire, to rise to a challenge of trying to assist mobility and access into the city centre for those people who live with dementia. We immediately asked Claire, with her expertise, to identify ways we could help. And over a period of months, this developed into what is the world's first dementia parking scheme, which went live probably about 2 years ago in Western Approach and Theatre Royal Car Park. And we've continued to expand with the latest spaces opening in Crown Hill 2 weeks ago. It's received significant national and industry publicity. Plymouth City Council were awarded an Inspiration Award for the work we did with that scheme through the British Parking Association in 2015. And we've supported Middlesbrough, Luton, Berkshire and Shropshire with the rollout of similar schemes within the UK. And as Claire alluded to, I've had some conversations with the Mayor of Vienna to look at how they could potentially roll something out in Austria, and also the local government officer from Budapest, but we had a bit of a communication issue. I don't think I understood him or him me. Significantly on from that, being the CCTV manager, we've also used our links with the police to ensure that all of the parking staff and CCTV staff are trained as dementia friends. Now when there's a report to the police that there's a vulnerable person missing or has wandered away, the CCTV officers pick that up from the police radio, will immediately then radio all the parking officers who will stop their enforcement activities if they're in the area where the vulnerable person was last seen, to assist in trying to identify and locate the vulnerable person. Again, it's something that we're incredibly proud of, and something that, again, we're here to support our communities, and I think this is a really good way to show the communities that we're not only here about issuing yellow tickets and making people pay for parking. We are here to be a cornerstone of our community.
Darren, thank you very much for that update on that. Claire, is there anything else you need to be added?
One of the things that Darren hasn't said, probably because of the time issue, is there are other things that his team do off the radar that are absolutely dementia friendly as well. So if I've ever sort of had some feedback from people that have found particular parking issues difficult, I know I can speak to Darren and he'll do his best to sort them out, and that happens every so often, doesn't it? Just very quickly, as I know we're pushed for time, going on to the next bit about our library service. They do various different dementia-friendly activities and have done so for quite some time. The next slide is just a selection of some of the feedback that has come out of the Memory Cafe that's been in St Budo for just over a year. The facilitator of that, Debbie Bendin, who I mentioned earlier, is one of the most awesome practitioners I have ever come across. I've been to that Memory Cafe, I've seen the way she interacts, I've seen her skill level, her knowledge level, expertise, and people keep coming back. She panicked in the early days. The first couple of weeks, she said, "Claire, no one's turned up." I said they will, and they absolutely do come back time and again, and they spend the whole 2 hours just laughing and enjoying themselves and forgetting the difficulties of their condition. The next one, the GP practice, that's just one example that comes from the first GP practice that I worked with, which was Manamede. And as a result of sort of attending the awareness session, one of the staff members, when a new patient came to register at the practice and said they had dementia, this particular member of staff remembered how important it was to just allocate that bit more time, and spent an hour talking to that particular patient and getting all the details and making them feel completely comfortable and able to sort of say what they needed to say. And another side effect from that particular one was one of the assessments that I did involved some changes to signage, and some of you may know this, that some of the recommendations for dementia-friendly signage are a yellow background and bold black font. So I had said all this, and then when they put all these new signs up, a patient actually came in and asked why the changes had been made, and when it was explained, she went back home, bought herself a yellow pad of paper and a black pen and started writing messages and communicating far more easily with her husband who had dementia than they'd been able to do for like a very long time. So that's a nice sort of side benefit of that. And then lastly, Plymouth Dance, the Tea Dance with a Twist project that they facilitate once a month in the Guildhall, has an immense number of people that go to that, and what's very nice is it's become very intergenerational over the last year or so that it's been running, and you will get people that just come because it is just a really positive experience. You know, I went and volunteered on one of their sessions, got speaking to a lady 90 years old who had come on her own on public transport, absolutely loved it, and said, you know, I'm going to come back every month if I can, you know, God willing, health-wise. So that leads me on to the very last bit, last but not least. I'm going to ask Anne from Plymouth Argyle if she'd tell you a bit about the work that they've been doing.
Hi. We started looking at the whole issue of what the club, as a club, as you know, something that's at the heart of the community, could do about 2 years ago when Ian Sheriff, on behalf of the Dementia Friendly City Initiative, came and asked us what we could do. I think his idea at the time was that we would simply deliver awareness sessions to all of our staff, but the more we talked about it, and because I have personal experience of supporting my dad through living with dementia, it became very important to us to not just tick a box, but to do the maximum we could. So over the past 2 years, we have developed and now have up and running a whole range of initiatives. One is a football cafe, and we try to go away from the model of a memory cafe and the idea of that can generate, which is that people with dementia live most happily in the past. You know, we wanted to create something that was about very positive experiences now and connections to, people should have connections to their peers. So we also base our activities on cognitive stimulation therapy and the learning of new things, just to give people, you know, something that's very important, which is a sense of having some control over their outcomes and over the quality of their life. Everything we do is also about fun, and we've done, you know, not just football-related activities like playing football and football skills and refereeing games. We've done lots of activities, from making mince pies to playing conkers, doing Tai Chi, learning sign language, you know, lots of different activities. Our second, alongside that, we saw the opportunity to offer to family members who are supporting people living with dementia a break and something positive for them. And so we run alongside that a peer support session, which every other session also has mindfulness meditation delivered by Plymouth Options. We do also supported match days, so we support people through the whole process. People who would find it just too overwhelming a challenge to come to football matches, we support them with reminders, help with transport. We have a pre-match social meeting. We get together, we look at the manager's interview, for example, over a cup of tea. We then watch the match together and we make sure that people get home safely. As an extension of that, we secured sponsorship at the beginning of this season from HSBC to deliver a set of golden tickets, if you like, for every GP surgery in Plymouth. And that is for 7 supported match day experiences. And that's now in the process of being, the GP surgeries are identifying a patient who loves football, who wants to come and be part of that. And the last one is our senior advisor roles. We appointed our first senior advisor, who is a former football coach, at the beginning of this season, or about 3 or 4 months ago. He now attends academy sessions and helps with training, evaluation of players, and so on. And as far as impact is concerned, we obviously that's based a lot on the feedback that we get and that we encourage. Cafe members, have said things like it's the highlight of their week. They look forward to coming. They're excited to come. They feel a buzz afterwards. And the family members have, some of them have called it their support session a lifeline. They've said it reduces their feeling of being isolated and gives them some me time. So that's pretty much what we have. Actually, I should say, in addition, because we also want to get it right, we have an independent assessor who is compiling an evaluation of what we do, kindly funded by John Mahoney and some funding from the Peril Ward. So we felt that was very important, that it's not just what we feel, it's what somebody else feels.
Thank you very much indeed for that. I'm going to open it for questions, but Claire, just something that's been brought. I mean, I sit on PADAN from the council, and one of the things that I've heard mutterings about is that when a building is assessed for being dementia friendly, sometimes they're given advice as to about moving mirrors and things like that. The only drawback is apparently, well, obviously, that people with disabilities actually need a mirror to make sure that they're dressed properly after they've finished doing bits and pieces. So just wondered, how are you managing to square that circle?
I never tell people to move mirrors, never. I just make, whatever the organisation is, I make them aware that mirrors can be problematic for a lot of people with dementia. The reason they can be problematic is some people can get to a point in their dementia where it progresses, where they start struggling with recognising faces. So people that they know really well, nearest and dearest, but also struggle to recognise their own reflection. So for example, when they go in to use a toilet, that can happen where they go to wash their hands, and 9 times out of 10 the mirror is above like the wash basin, catch sight of themselves and then panic and start to get distressed quite quickly because they imagine that there's actually a stranger in the room with them, which is obviously quite disconcerting. So what I usually suggest, the recommendations that I make around mirrors very much depend on the setting that I'm in. So for example, if it's a GP surgery, I will say to them, right, if you have a way, and most surgeries do, flagging up on your system when a patient with dementia is expected in for an appointment, I know you can't predict whether they will use the toilet or not, but err on the side that it's a possibility. Perhaps the person that's on reception, just before they're due to arrive, can go into the toilet and just quickly cover the mirror over with something so that if that is an issue, it's not going to be, they can take it down after. If they find that it's affecting quite a lot of people that are coming in and out of the building, I suggest perhaps putting a more permanent solution in, like they have at Derriford on some of the elder care wards, and just investing in a small pull-down blind that they can put over the mirror. But I never say to any organisation, take the mirror down. Quite the opposite, actually, because I might say to people something like, if I was purpose building a building just for people with dementia, this is what I would do. But I understand this building is used by a lot of different people with differing needs. And I completely agree with you. Some people with disabilities do need a mirror, particularly in lifts for sort of manoeuvring and seeing their way out if they're a wheelchair user. So that's usually the advice that I give.
Thank you. Right, open up. Whoops.
Oh, thank you, Chair. I'm not going to ask a question. I'm just going to make a statement. What a team, eh? Unbelievable. Really great stuff they're doing. And I think it's a credit to this authority that we do employ somebody on a permanent basis. And as was said, not many do. And I think from my experience, they've grown as a group and as a movement, they've grown and grown. And that was recognised at the Star Awards because Claire was awarded a Star Award by our staff peers, and I think well deserved. And I would just like to say thank you to a group of people that really make a difference in Plymouth.
Thank you. Councillor James.
Yes, thank you, Chair. I think the first thing I'm going to say is I'm so proud that Plymouth is a dementia-friendly city. And I echo what Councillor Tuffin has said. the fact that you've come here and gives a presentation on things which I didn't quite know what was going on in the city for people with dementia. Thank you for what you're doing. Really appreciate all the initiatives, the support, and the messages you're providing for these people. I think it's a very cruel illness, and all the support we can give them, the better we can. You know, it's. Can I just ask you one question? On your slide, you said a third of people with dementia live in their own home. I know you didn't go much on the support about it, but what about the other 2/3? Where do they live with families? Do they go into residential care homes? What happens to them?
Yeah, some are in residential homes. The third is about people that are living completely on their own in their own home, so not necessarily with a carer, with a partner, with family that are living nearby. But the others are in care homes or living with family.
Thank you. That leads me to the question, which could be my original question, actually, fact. Do we have enough care homes in Plymouth to support people with dementia? Do we need more? And the other question is about people living independently on their own. My understanding with dementia is they can walk, they can go out for long walks on their own, especially at night time. What support is there for them of a night time?
Yeah, I mean, I think in terms of care homes, I think the issue is obviously what we want to do is work with the care homes that exist to make sure that the quality of what's on offer is good, and that's what we do. We have in our commissioning team we have a quality team that support care homes to make sure that it's what quality is on offer. I don't think it's about that. I think we do have, as far as I understand it, we have enough care beds, but it's about the quality of what's on offer, and that's what we're working with them to do. In terms of people being supported, we have a range of ways of supporting people with dementia. So there's lots of potential for aids and equipment, particularly at night time. So people can people who have may have a social care package, may be able to get help with equipment and things to sort of. So there's things like alarms that go off if you move in bed, alarms that go off if you go out your door, that sort of thing. But we do also have support services. So obviously people get support depending on, they get assessed by social care and they may get support. We have a dementia support worker service that provides support to people, advice, information and advice and other support to people as well that we commission. So there's a whole range of things that are in place for people depending on the stage of their dementia, and obviously there's an assessment process, but there are lots of services available.
I need to come back to you again if I may, particularly around residential care homes. Do all residential care homes have places for people with dementia? That's one thing. And if they haven't, then there's a bit of a problem, because you've already mentioned that dementia is going to increase in numbers in the following years, especially as people are getting older. We're in an ageing population. What are we doing to provide for the future of people with dementia? Because it's going to get worse.
Yeah, no, not all care homes will be specialist dementia homes. We are obviously doing a lot of work around, we do a lot of work in commissioning around the future demand on the market. So we are doing work around looking at future demand and what the market requirements are, and working with the care home market to stimulate that provision. So that's work that's ongoing in commissioning, and certainly we're very aware that work needs to be done around dementia care. And obviously we want to try and keep people at home for as long as possible if that's where they want to be. So it's around support for people in their own homes as well as care homes. But yes, we do that market, working about what the demand's going to be and what the market needs to provide. So that's and we can certainly provide you that information if you need it in future.
I am concerned about it. I have to say, I can understand some care homes not having dementia people there. I can understand that. But my concern is the future of people with dementia. How are we going to accommodate them if we haven't got the accommodation now as such?
Councillor MacDonald.
Just a couple of quick requests for an update, really, because on my watch, when we sort of started this dementia thing from you, Chair, we had work in schools where people with dementia went into the schools, so that if their elderly relatives, the children's elderly relatives or relatives contacted dementia, they were less afraid and wary, and also it was a kind of solidarity between the generations type of work. So I just wondered if that carried on. And just quickly, Chair, this can be emailed to me. What happened to the Prime Minister, I believe it was David Cameron's, dementia challenge? And is Angela Rippon still the face of dementia? Oh, the Prime Minister's face of dementia, that is, sorry.
Yeah. The schools work. I have done some work with some young people, but that is actually my next focus area, starting early next year.
Yeah, so the Prime Minister's Dementia Challenge was updated, I believe, last year and focused very much. I think the last challenge was much more about research. I think there's investment into research, wasn't it, to try and find cures for dementia. But yes, Angela Rippon is still very much involved, and she is still. I think she still chairs the Prime Minister's group. Yeah, she still chairs the Prime Minister's dementia group. Yeah.
Can I say thank you very much to the four of you for coming along? Who ever thought, when four of us sat in the Lord Mayor's dining room, with the Lord Mayor finding some stamps somehow, I'm not too sure how I managed that, and a huge list of people, I think there's about 101 organisations that we had to send out, that we would have got to this stage, and I am just so pleased that it's taken on and that we have developed it so much. It's good to behold, and I look forward to hearing whether the shopping area is able to do something that they plan. You know, it's quite a pioneering thing, isn't it, to put on that hour for the shopping spree. So it'll be good to see how. I mean, this is not a static thing. This is developing all the time, and you know, we look forward to hearing from you again. And Darren, I certainly know that you and your team do sterling work with this, and certainly the work that you're doing with the dementia-friendly status and with most disability status, and no doubt Argyle, you'll be putting your two pennyworth into the planning application that's going to be going in, and the disabled-friendly stuff that they're going to be looking into that before they carry on with the build. You know, we've got ideal opportunities here to improve life, and that's what we should be taking. So thank you very much, the four of you, for coming along. Right, we now move to our to follow papers for the Torbay Children's Services report. We've got Alison here and David, and we've got a presentation, which admittedly we didn't get till late, but I'm hoping some of you will at least have had a chance to peer through it. You really, really don't have to take us through it line by line, please. Please. All right. The floor is yours.
No, sorry. Thank you, Chair, for the opportunity to come in and speak to the committee this afternoon. Apologies for the late arrival, but you can imagine we've been working up to deadlines, and we had a cross-party meeting on Friday that sort of looked at where we were and just gave me a bit of a steer before I came through with this presentation, so that's why. So hopefully everybody's had a chance. What Alison and I would like to do is just pick out a couple of headlines from that, and then I think the best thing to do is to go to questions, if that's okay.
So I will give you the headlines in terms of where we are with the programme structure, so that since the decision in principle was taken at full council, we have now agreed, following an initial scoping meeting, we have agreed the programme structure and had an initial governance board. Sorry, we're struggling a bit to get the slides to follow the what I'm saying, but so that the programme board has now met and agreed the time frame for meetings going forward. We've agreed what the programme team and what the work streams will look like, and as well as quite a tight governance board chaired by the Director for People here having met, we've had a stakeholders engagement event which includes those responsible for the different work streams. And so when you look at your slide pack and the slides here, you will see that we've set out a visual on what that structure looks like, and given you the information about the different work streams. It has been agreed that we will take a phased approach, and this is the approach, this is the phase now, between now and the council meeting at the end of January, where we are doing the due diligence and assurance work, whilst in parallel we've set up the programme board, and then on the next slide what's set out are the different work streams. And what you'll see from that is that we have a project team working in each authority and work stream leads who, on the next slide, it sets out for you the different work streams, and I don't think I can do it from here. No. That's not working. If we could have the next slide. Oh, that's it, yeah. So whilst you won't be able to read the names in front of you in your hard copies, you've got that. But that's just really to show you that there are a number of different work streams which have started doing the work in anticipation of being ready to move into phase 2, assuming that at the end of phase 1 we have assured ourselves and you that we are in a position to seek agreement to proceed beyond the end of January. And these work streams will then be setting up what the arrangements will look like from an aimed go-live date at the beginning of April. And again, these work streams would then continue in the transition phase to plan more detailed work. And I'm going to hand over now to David to take you through the progress on the due diligence and assurance work.
Thank you, Alison. First thing to point out then, we've had a lot of debate about due diligence versus assurance and which one we're actually doing. And due diligence, if we go to the dictionary definition, talks about we'd be taking over a company and checking their balance sheet and making sure they're a worthy return on our investment and so on. So that's why we've kind of moved on to assurance, because what the task I've been set here is to give assurance to you as a scrutiny committee, obviously to all the members ahead of the next council debate, to give assurance that we're going into this with our eyes wide open as to what Torbay looks like in terms of finances, HR and of course children's services. I won't be able to tick every box and say they pass every test, and that's why it won't be a due diligence, because if that was the case then the question's been posed back, well, why on earth would we be working with Torbay in the first place? There must be something that we're trying to help with. So the approach that I've taken on getting the assurance and working with the team is to go back to the amendment that was tabled at the full council meeting on the 25th of September, and all the requirements that they wanted to see and the assurance they wanted to receive. Looking back to the minutes of our previous visit to this meeting, actually, I see that the foundation of those recommendations came from here anyway. So if you've got sight of those, I think we cover those off. So, I mean, the main areas that we've been looking at, obviously, are resources. There was a lot of conversation about the capacity and the capacity of the senior leadership within Plymouth, and whether they would take the eye off the ball for what we're delivering for children in Plymouth and concentrate on Torbay. Finance obviously plays an important part. and there were lots of questions about the political and legal and governance and who scrutinised what and who's responsible. I also put in a couple of extra ones there, which was about communication, because I think if we can get that message out to both organisations correctly, that would be a huge benefit. And of course, we can't close our eyes to ICT, but again, as Alison was saying, there's a couple of phases to this. So if you look at ICT, it's not about having a solution on the 1st of April, a joined up system, whatever we want to call it as a solution, but it's making sure that we can work from the 1st of April so that we have the necessary tools in place. So hopefully you've had a chance to read through the actual presentation, and like I say, the approach that I've taken is to go back to each question that came up at full council and to try to give some assurance. I know Councillor Tuffin is representing us, as is Councillor Sue MacDonald, on the cross-party working group, and I think a lot of these questions were really usefully aired and then answered when we had a visit from 2 representatives from the DFE and also John Coughlin as the Commissioner appointed by the Department for Education. So between them, they were able to put a lot of those questions to bed, and I've picked up their responses and put them into the slide pack. So quite happy to take any questions on those. And of course, then in terms of, well, what's the leadership capacity for Plymouth and then Torbay? I can say that Tracy Lee, as our Chief Exec, is working very closely with Carol, as you'd expect, and has already put a paper together and I think briefed both the leader and opposition leader about what our plans might be as to how we address the capacity and how we make sure that we do not lose sight of what we're trying to achieve here in Plymouth. Again, quite happy to pick up on those kind of questions. Another key question, I think, quite rightly that you asked was, what happens if Ofsted knock on the door? That's why I've got Alison with me, because Alison is an Ofsted expert and I'm not. But that question was put point blank to the DFE and to the Commissioner, and quite rightly, they said, obviously we cannot influence the work of Ofsted. They come in to do an independent review, so you have to take the questions as they come. But we would all be very surprised if their first question wasn't about the capacity. So if they're doing an Ofsted on Plymouth, they're bound to ask, what is the capacity at senior level, and is there an impact from looking at Torbay? And if they were doing a Torbay, they'd ask the same kind of question. But I mean, that was the categorical response, that if they're Ofsteding Plymouth, they are Ofsteding Plymouth, and if they're Ofsteding Torbay, it's Torbay. It's not. They're not going to come down and say we're going to look at both and try and mix and merge. So I think that was an important part. But if you've got any questions, I'm sure Alison can pick up on that. And then just to give assurance to the team really around finances, obviously, because I did say early on that I wasn't going to just go in and look at the department called Children's Services. You've got to understand the whole. So I've been asking questions about the whole of the MTFS and next year's budgets, and looking at what's been put in for Children's Services, obviously in particular, but also the affordability and where they thought they were going to get the resources to pay for that. And then you can imagine a lot of attention to the savings plans that they put forward, and whether we now think that we understand where they're going and the direction of travel. Quickly, Chair, I'll just mention, because again it was important and it was one of your absolute questions, which was this should be at no cost to Plymouth City Council, either in this phase as we lead up and do the assurance, or in the implementation phase, or indeed as we go forward. So I can now say that there was a lot of toing and froing between myself and the Department for Education. What we asked for, we got. Which is quite unusual, I'm told. Actually, they're trying to be very helpful with me in saying, even though I've categorised where the spend should go, as long as I live within that overall envelope, they'll cut me a bit of slack, if that's the right term. And I think it's important to note that not only did they agree straight off that even though we hadn't really started formal conversations, we had involved officers in travelling up and down and time, that was paid for. That's a first. I also managed to persuade them to say, look, when you get to the 1st of April, the world doesn't stop. We go on then into the next phase, but the people that are helping you to develop systems, etc., don't just walk out the door on the 31st of March. So again, they agreed to some funding to see us through April, May, June. So again, that's quite an unusual situation that we're in. So I think I can give you assurance on that one that what we asked for, we got. Obviously, there's still some work to be done now about ongoing funding, but I've put my thoughts into Torbay Finance. I'm waiting for them to come back with theirs. I'm sure, as in all negotiations, I'll be over here and they'll be over there, but somehow we'll meet in the middle. And then finally, Chair, just to wind up, I'm conscious that there's very little time. Someone invented Christmas, which is great, but we do have to get ourselves to a full council decision on the 29th of January. So what I'm planning at the moment, and it's being set up, is to sit down with the Cabinet Member for Finance and the Shadow Cabinet Member for Finance, because I think they will be most interested in digging into the numbers with me and the governance arrangements. But also, we've said that we're quite happy to come back to another Labour group, another Conservative group, so that everybody gets sight of what the paper's saying and it doesn't come as a surprise through to Council. And I think at that point I'll stop and just take any questions.
David, thank you very much. Thank you, Alison, for that. Any questions, team? David.
David and Alison, thank you for your presentation. David, I know how keen you are on saving our money and things, you know, but can I just ask you about the transitional funding, which was approved for £1.518 million? How did that come about? How do we know that's the figure we want? I know you've got a contingency of £100,000, but what if we find it's going to cost more? Can we rebid for any more? Or if we find we've got money left over from that initial bid, where would that money go? Would it come into Plymouth or would it go into Torbay?
As always, Councillor James, very incisive questions. Let's be clear on this one, because I've said this to the board that we've set up, and I'm quite happy to say it to anybody who asks the question. In terms of this funding, this is a separate contract now between Plymouth City Council and the Department for Education. So this is transitional funding to ensure that Plymouth are able to do what they need to do to be ready for the 1st of April. So it's a contract between ourselves and DFE. In terms of, is it enough? Well, I know I can be a bit flippant at times, but it's never enough. I would like double that, maybe 3 times that. Just to give assurance, though, it's more than the Commissioner thought that we would get back, and he's asked me to do the negotiations next time when he has to talk to the DFE, because it's much more than they got in bid funding. In terms of the detail behind it, well, obviously I started conversations, part of the early conversations with my colleagues in Torbay, Andy Dempsey as the current DCS and Finance, about what funding do you think you would require in order to help Plymouth to set this up. So we've had those conversations, that was built in, and I've then talked to relevant areas, ICT, etc., about what backfill they might need and so on. So I'm fairly confident that the 1.5 is enough. In terms of what happens if we live outside of that one, that's not going to happen, because that's not the way I work, Councillor James. And in terms of if we were to manage to come in, I don't know, with a couple of hundred in our back pocket, negotiations with DFE, but at the moment there's been no conversations about having to repay anything.
Thank you, David, for that. I just want some assurance that if we found that we needed quite, some more money, or we didn't have enough money to do it, but you've assured me that we have, so that's minuted.
Thank you.
just to let you know.
Sorry, can I just add, because I should point out, obviously, that should we get to full council on the 29th of January, and the decision is that Plymouth don't go ahead with this project, then at that stage, I'm sure my first phone call will be from the DFE saying, right, that money that we sent you, David, when can you get it back? But that's not going to happen.
We would have made interest on that, wouldn't we?
Yeah, absolutely.
David, one of the things that we asked was about a risk register. One assumes that that's being put together now. Will that be in the papers that come to council on the 29th of January so that we can all have a good look within our groups at it beforehand?
Absolutely, Chair. Yes, you're right. We've developed it with your help, of course, and through the groups. It is used now at the cross-party meetings, and it will now, it kind of moves away from that area into the full programme arena. So it'll be picked up by Anna and the team, and we're all updating this week, ready for the board meeting on Monday. But absolutely, yes, that will be in the papers, and more than happy for it to be shared.
Any more questions from anybody? Councillor Tuffin?
Thank you, Chair. I feel honoured bound to say something as part of the cross-party group that's been looking at it. And I just assure the members of the Health and Wellbeing Board that we have gone into it quite deeply, and many of these questions have been explored far more deeply than we can here. And I have the confidence that, in principle, it's something we want to go forward with, and I feel there's safety in the fact that we've explored it extremely well, and I just wanted to share that with the group. I'm sure my colleague Sue MacDonald would probably agree with that, and I think it's been good to have that opportunity to cross-party. We've been meeting almost on a fortnightly basis, so yeah, give you some understanding of the detail we've gone into. And I suppose the bottom line for me, and I'm sure colleagues, is it's about the well-being of the Torbay children. And I think we've got to keep a view on that, because we do get bogged down with who's been exploited by whom. But the bottom line for us, I believe, is to be able to add value to that service and be part of them coming forward in the future, because obviously it's been a long time, and I won't use the word failing, it's been a long time not making the progress it should have made. And I think, rightly so, we should be part of the solution of that problem.
Thank you. Councillor MacDonald.
Well, Councillor Tuffin said quite a bit, but I'm very pleased about the cross-party support, and we've done it with schools as well, motions on notice, where we have got cross-party support, because as Councillor Tuffin has said, it is the children that we focus on. But beyond that, I believe, it is about the public sector helping another part of the public sector, and the values of cooperation and the values of fairness and justice for those children who are in that system that isn't functioning properly. So for me, it is about somebody lending a hand where there's need, and we might need something one day, because let's not forget Torbay's education service is better than ours. So I think it's good to see the public sector alive and well, and that ethos still shining through.
Thank you, everybody, and thank you to Alison and David for coming along. Basically, I'm presuming your recommendation is that we support the recommendations going to Cabinet in principle, and that obviously we will want to follow this through at a later stage. And I mean, the reports will be going to the groups for any input there, but certainly you will deserve your Christmas holidays at this rate. So thank you for all the work that you're putting into this. Okay. So the recommendation that you want to write following this, you happy with what I've said?
Through you, Chair, yeah, I think pretty happy with what you've said. So you've suggested that the committee is content in principle with the information that you've had before you today, that you're happy for it to go forward to Cabinet for its for recommendation with all of the required paperwork, and that you'll take a view, I guess, at Council. Thank you, Chair.
Thank you both very much. Now, Alison's staying, aren't you? Yes. Right, thank you very much. Agenda item 9 is because we asked some questions following a report. So, in theory, we should just basically have been able to read the report, make sure that if there are any questions we need to ask for clarification, that comes up. But, you know, really it shouldn't be a lot of hard work, really. All right. So thank you for the report. I don't know if you want to say something, Siobhan, for joining us.
Okay, thank you. I sort of feel like I should apologise for dragging you down to detail in this time of the afternoon, really, as the sort of skies darken. I think what I would say is just to reassure the committee that this is probably a good news story and that we are moving very much in the right direction. However, it is absolutely an area that's appropriate to focus on because it is about actual quality of practice for our most vulnerable children and young people. Both the indicators that you've asked for assurance and information on are quite interesting in that they relate to historical practice. So any changes that we put in, because it's about repeat referrals to children's social care and repeat child protection plans for children at most need and risk, they're looking at practice that happened some time ago that's then coming back through the front door. So any measures that we put in take a while to work through. And they are systemic, quite difficult questions. They're not quick fixes. They are issues that to do with our process and practices, the demographics and national trends, and our partner agencies out there in the city. So there's no kind of quick fix. They're systemic issues. We, on both indicators in 2016-17, we're not where we wanted to be in terms of our statistical neighbours and the national picture. We are pleased that on both of these indicators we are now coming into line and are nearly at our target for this year, but we do recognise that we have work to do. We've done quite a lot of work both internally and with our partners to improve the quality of our practice to move this forward. I'm assuming, as you've said, Chair, that everyone's read the report. I'm very open to take any questions on the detail and the specifics.
I've nothing to add at this point.
Right, questions, team. You've stunned them into silence. This has got to be a first.
Briefing on this morning, and that was before I knew I was substituting here today. I'd already arranged to do that, and I've asked quite a lot of questions, even across from the Herald headline about 100 and something homeless children, and was there any correlation between children who not slipped off, but who needed to come back into on a care plan, and how did, you know, what were the factors and what are our partner agencies doing, and what is the safety board doing about this and holding partner agencies to account. So just to reassure you, as the shadow lead member or shadow member, I have been asking questions this morning about this and relating to other factors that impact upon children's lives.
Thank you. I think it beholds us all to keep updated on this and to make sure that we're supportive of our staff doing their job, but also making sure that our children are safe in Plymouth. You're right. Councillor James.
Yes, just a quick one. I know we have to rely on agencies to look after our children in serious case reviews, but there have been incidents, as we all know, where a child has been terribly abused and killed in some instances. And when it's gone before court, the blame has been put on the agencies, not connecting with each other. A catalogue of areas from here, a catalogue of areas from there. I hope we never ever see that again, although I know you can't guarantee it, but it is a problem, and I wish you well. I hope everything goes all right, especially for the children concerned. I hope this never happens again, because children do die because of these incidents.
Can I ask you to thank your hard-working team for all the work that they're putting in, not just around this time, but all year long. You've got a good team. Obviously, no doubt we will see you back here when we have the safer... What am I talking about now? The board, when we get Andy Bickley, the Safeguarding Children's Board, you know, it may well be that you give us some updates as well on that. Okay, thank you very much for coming along. Right then, team, we're getting along now. Yeah. Item 12 is the recommendations from the first bit of the GP Select Review. You've got the recommendations within your pack. Page 24 and 25 of the supplementary pack, to which I can't find at the moment. There you are, see, they've been pinched. Right. So, page 24. So, there were certain things we agreed that future change to GP surgeries, which include information on engagement and consultation activities with patients at the earliest stage. And then we've got 2, 3, 4 and 5. The one I would like us to add is I'm quite concerned that Cornwall has been offered to be part of a special area where there is going to be, let's say, perks offered to attract GPs to Cornwall. I actually think we ought to be asking the Secretary of State to make sure that Plymouth is included in that, because I think the stats show that we're equally as needy, should we say, for that sort of an attraction. I don't know if are you happy with that?
Yeah, why not?
Councillor Tuffin.
Yeah, I'm definitely happy with that. I thought of another area we might request, and I'm looking to Ross for formal words, because at the session we did talk about integrating NHS England's money into our CCG to have a much more integrated GP service. I wonder if we could ask that the possibility of exploring some exchange of that funding to be managed locally might be a reasonable request.
You have chuckles coming from Ross, which usually means that we're perhaps pushing our luck. But Ross, any ideas?
Chair, we've not made mention within the recommendations about the previous programme of GP or primary care co-commissioning. If you wanted to explore something like primary care co-commissioning and what happens beyond that, at a more localised level, it's certainly something we can request.
That sounds very much exactly what I was thinking, Ross. Thank you.
Okay, anybody else with anything that they would like to add? No? Okay, Ross, so you know what you're adding there, and I've merrily scribbled over those things that I've signed.
Scorecard.
Right, scorecard, we've had no questions coming in about the scorecard, and it's not been updated because they don't do it till it's the score. It's 2 monthly or 3 monthly, so that's why it's not been updated basically from September 1.
Through you, Chair, you've got 2 reports there, members, which are quarterly reports. So there's not been another update since your last meeting. Yeah. We've put it on there because it's a matter of course. Yeah. If you wish to get someone along, we would have done that. We've not had any requests, so we've not done that. So propose you move on to the next agenda item, Chair.
Same applies to 12. There's been no further update on that. There obviously will be for the February meeting that we have. So, if we move to item 13, which is the work programme. We have now completed today. That's all right. Yeah, by all means. Thank you. If we look at February the 14th meeting, we have mental health, the community safety partnership, integrated fund monitoring report and the commissioning scorecard, and age appropriate dwellings. If you remember, Councillor Bridgman raised her concerns, and obviously we will get, so we couldn't fit it into today, but we will get something along for that. And then at the moment, the April one, whilst we've got the Care Quality Commission there with the outcomes of their recent visit, it's still flexible enough that if we feel there's something that needs to be added, we can do. Any thoughts? No? Anything else you want to be adding?
Quite a bit there.
Okay. I mean, the GP select committee will need to meet again. There's no two ways about it, but I think it'll be February once they've sorted out what they're doing about any procurement, etc. So I think we just watch that space on that.
Yep.
Can I thank you all? John, yeah. We did do that earlier as the minutes, when we did both of the minutes. Was there something that you'd felt?
Microphone.
Can you put your microphone on, please?
I was at a prior engagement at school. I thought the paragraph talking about, where are we, 3C, Hyde Park, St Barnabas and Saltash Road closed, and an interim provider Access Healthcare took over the contract for Ernest Settle, Mount Gold and Trelawney GP surgeries. Well, wasn't Access Healthcare already running Ernest Settle, Mount Gold and Trelawney, and it added to it Hyde Park, St Barnabas and Saltash Road? Because they've not been run by an independent contractor for about 15 years. So it's a small point, but is that correct?
We'll get that checked for accuracy and make the adjustment if it's not accurate. All right, thank you. Can I thank you all very much indeed. There are behind you some mince pies, and for those that don't like mince pies, some cherry bakewells, but you're welcome to take one with you, and there's some cream for those that are addicted to clotted cream.
Oh, you can't break me.
All right.
You've covered all the diabetics.
Please, you're welcome to join us as well. Thank you very much indeed. I hope you all have a very happy Christmas.
Yeah, you too.
PCT's been running them for years, and I'm not quite sure when Access Health took them over. But